Well, this is the easiest one. If I can't do this, I'm in trouble.
So make sure you
And
do your
wanna
whole
bend
foot.
more.
Yeah, there you go. Nice. And you get that nice pull back
We
there.
do some of the same thing in yoga.
Back, there you go. Good, and hold that, hold, and relax. So sometimes you feel a little pull by your incision, but that's okay. We can't hurt that incision.
Yeah.
Good.
It's
And
pretty,
relax.
it's pretty bulletproof.
Yeah, very bulletproof. And then relax.
I don't know if that's its reaction to.
That's pretty normal because you do have some swelling around there.
Okay.
So the first few usually feel stiff and then it kind of loosens up.
Good.
Okay. I got it. You can let it go down.
Again, breathing, huh?
Yeah. So these are meant to be gentle, non-strenuous.
All right.
Okay.
Sounds like you talked to a lot of guys who just
Yeah.
power through it. A little tightness in the knee and a little tightness.
That's from your swelling. Now, is this something that was difficult to do before your surgery?
Good question.
Yeah. All right.
Do we worry about the other one or not? No.
Yeah.
Okay.
You're going to get a lot of exercise on that one when
Sure.
we get up and walk around.
And this is the adductor.
Yeah, this is the sliding out and back. So we want to make sure we keep your toe kind of pointed up and not,
Right.
rotating out as we go.
Well, do I hold the left leg flat and?
That leg can
Yeah.
do whatever is comfortable.
Okay.
Okay.
And we're going for some sideways.
And this is usually the second hardest one.
How much are you doing?
About half. Go
I
ahead
think
and
you-
relax.
I think you are doing
Good.
that. She's literally
So
trying
I'm
to
gonna
get it
I'm gonna lift it and let you hold it up here. So this is again trying to push your knee down flat. Good. Okay. I'm gonna let it down slow. Good. And Colin came to see you this morning.
Uh-huh.
Did he look at your knee, or did he just check your incision?
Check the incision.
Okay. All right. Okay. Kick again. Kick. Good. Hold. Squeeze. Push down. Yeah, he's having a hard time waking up today. Okay.
Do it again.
Yeah, let me bring you up. Good. And try to push down. Hold that up. Hold that. Kick that ceiling. There you go. To the floor. Gravity can't pull on it. Good job. Go ahead and keep scooting forward till that touches the floor. There you go. Okay. Want to come forward a little more?
Sure.
There you go. Okay, we gotta watch that lean and forward scooting too.
Mm-hmm.
Alrighty. Okay. This foot go down all the way?
Yep.
There you are. Okay. Alright. How's the woozies this time?
Better.
Good. Looks like they got you a little patch too.
Yeah, it may have helped. Thank you. So we want to be thinking about 50% of the weight
Yes, I
on
was
the right.
just gonna start talking about after I got you.
What is this little guy?
This is my safety belt, so I can steady you if you're wobbly or woozy.
Good.
Plus, my dad said when I find a good man, I should hang on to him. So
There you go. Good.
gotta do what your dad says.
That's exactly right.
Okay. So 50% means if you're standing up with your weight equal between both legs, that's 50%. And you can pick up your operated leg, no problem. We don't have to worry about anything when you're picking it up. When you're picking up your opposite leg, that's when you need half your weight through
Okay,
your
well, I'm glad
arms.
you defined 50% because I was assuming incorrectly that it was half what you usually put on, half of the weight bearing. But in effect, it's 50 from each. Is that what you're saying? Each one is 50?
When you're standing,
This one is, or,
normal, you
Yeah.
are 50-50.
right.
But as soon as you unweight this leg,
Uh-huh.
this leg now is responsible
Got it.
for 100% of your weight.
And we don't want that.
So we're going to use the walker
And your
To
arms
take-
take over?
50%, so your leg stays 50% and your arms get 50%.
Got it.
Mm-hmm.
Okay.
Yeah. So what it's going to look like when we walk is it's going to look like the walker being your frame, your operated leg forward, so you can lean on the walker and take that weight. And I think today we'll just kind
I think I
of
can
match
do
your
that.
step. We'll do
Yeah.
a step 2.
Good.
Okay? All right.
Happy to give that a try.
Okay, do you remember the one or none rule?
I don't. Help me out.
Okay, so this walker isn't going to give you much leverage if you pull on it with 2 hands.
Oh, yeah.
So when you're sitting and standing, let's wrap this around again. You can have one hand up on the walker and one hand pushing up from someplace that's stable, or you can have none hands on the walker and both hands push
Well,
up from
the
there.
walker doesn't look like it's going to go anywhere, so I'll go for 2 hands.
Okay. Good.
Not so bad.
Yep, okay. So I'm not gonna have you shift weight on that leg while the knee is bent. I'm gonna come down and help you straighten that knee before you put more weight on there,
Okay.
all right? So this would not be typical for the hip.
This feels like a exhibition I saw last week of kimonos, where you have stiff
Yeah.
fabric like that, and you need a dresser to
Yeah.
dress you.
Kimonos are actually very comfortable because they pack all sorts of padding in your low back with that
Right.
ribbon, and it totally relaxes your shoulders. It's really nice. Okay, so I want you to push your heel down so you're tightening the muscles in the back of your leg. Good. Okay. How's that feel?
It's good.
Okay. So we're using, because this muscle on the front is a little weak after surgery, or actually a lot weak after surgery, we're going to use the muscles in the back to help you keep your legs straight.
Okay.
They only work well if your knee is pretty much straight. So if you're trying to put weight on this leg with your knee flexed, it's going to, be difficult to control. Okay. So I'm going to have you practice just swaying like a tree in the wind. So, and then when you come here, remember to put weight on half your arms when you sway this way. Good. Half your weight on your arms. Keeping that leg straight by pushing your heel down.
Particularly now that you
Put
mentioned
weight
it.
through your arms. Good. Nice. Okay. Okay, I'm going to have you pick this leg up and put it down. Good. And then straighten that, push that heel down. Good. Okay. Pick this leg up. Put it down. Straighten it out. Good. One more time and we'll sit down. Good. Put it down and straighten it. How are you feeling in the woozy department?
I'm starting to get a little sweaty.
Okay, let's have you put this leg forward a little bit. That'll keep that hip angle open when you sit, and reach back with one hand.
Scooch that way.
This way.
That way.
There you go. Good. Okay. One more turn. Good. Okay, you can lift this leg up in the bed for me, and I'll help this one.
Okay.